physical activity in the senior population. The so-called aging of America is a well-known phenomenon. Throughout the 21st century, both the average age and the life expectancy of Americans have steadily increased. It is estimated that in the year 2050, the number of Americans over age 65 will approach 22% of the total population, nearly 1 in 4. Often discussed as a driver of Medicare spending is the accelerating growth in program enrollment that will occur with the retirement of the post-World War II generation, who began to turn 65 in 2011. In the years to come, we will see unprecedented challenges in maintaining the senior population's health status and in funding their health care costs. Between 1995 and 2009, as the group of individuals born during the Great Depression and World War II became eligible for benefits, Medicare enrollment grew by an average of 623,000 beneficiaries annually. Looking to the future, net Medicare enrollment growth is expected to average more than 1.6 million beneficiaries annually between 2010 and 2030. The program will reach a total of 80 million members in 2030, double the number of members in the year 2000. The effects of aging. Physiological aging refers to the changes in structure and functioning of the body that occurs over a lifespan. Many of these changes are involuntary and occur very gradually, while others occur over a short period. Following are the descriptions of some of the physiological changes that normally occur. 1. Changes in the cardiovascular system. Decrease in the elasticity of the blood vessels and heart valves, restricted blood flow, due to the thickening of the vessel walls and because of the fatty deposits lining the vessels, and a decrease in the ability of the heart to pump out as much blood with each beat. As a result, you may feel fatigued, become short of breath more easily and have less capacity for physical exertion. 2. Changes in respiratory system. Decreased elasticity of the lungs may occur with aging. This may affect your lungs' ability to utilize oxygen, as well as your ability to cough and take deep breaths. You may be more prone to fatigue and shortness of breath on exertion, and become more susceptible to infections. 3. Changes in muscular system. There tends to be a gradual loss of muscle tone, elasticity and strength. In some areas, the muscle is often replaced with fatty tissue, leaving you with little rolls or soft, flabby spots. But what is more significant is that your endurance or strength to perform certain tasks may also decrease. 4. Changes in skeletal system gradually changes over the years until it is porous and brittle, as the bones lose calcium and also their density. This may be more pronounced in women. As a result, you may become more prone to fractures, notice a decrease in height or even develop a stoop in your posture. 5. Changes in metabolic system. There may be a gradual decline in the activity of the thyroid gland, as well as decline in the ability of the pancreas to produce insulin. As a result, there is a decrease in the body's ability to use fats and sugars and to convert them into energy. You may note an increase in weight, an increased blood sugar level, when you go to the doctor, who may tell you that you have adult-onset diabetes. You may find a decrease in energy as well as decrease in your ability to handle stress. 6. Changes in digestive system. The digestive tract is a very resilient system, but there are some changes that occur which may cause you some distress. There is a gradual slowing of the system as well as a decrease in the secretion of saliva and enzymes, which are necessary for digestion. As a result, there may be problems with indigestion, elimination and adequate absorption of nutrients. 7. Changes in neurological system. What happens here is, the messages take a slightly longer time to pass from the nerves to the muscles, and the muscles take a slightly longer time to react to these messages. So take this into consideration while doing things that require a quick response. Also, there may be a decrease in the perception of pain and an increase in the time to react to it. This may seem like a blessing at times. After all, it would be nice for injuries and aches not to hurt so much. Problems may arise, however, if you put off going to the doctor for something that hurts you because it does not seem too bad. 8. Changes in genitourinary system. The ability of the kidneys to filter and reabsorb may also decrease. Also, men show a tendency towards prostate enlargement, while women have hormonal changes that may cause vaginal itching and burning, making intercourse uncomfortable. 9. Changes in sensory. There is a gradual decrease in the overall sensual acuity of the body. Your sense of touch is decreased, as is your ability to hear some high-pitched sounds. You may notice a decrease in the ability to smell and a loss of some of the sweet and salty taste buds. The lenses of your eyes lose some of their ability to accommodate, so you may find yourself reading at arm's length. The size of the pupil also decreases, sometimes making it harder to adapt to dim light. There may also be a yellowing of the lens, and decrease in color perception. 10. Changes in hair, skin, and face. In addition to the graying process, a small percentage of men are subject to baldness. As the skin ages, the various layers tend to lose their ability to retain fluids, and there may also be a loss of some of the fatty deposits under the skin. It also loses some of its elasticity. As a result, the skin may become wrinkled, dry and easily bruised. The link between physical activity, morbidity, and mortality. How physical activity impacts health. Regular physical activity that is performed on most days of the week reduces the risk of developing or dying from some of the leading causes of illness and death in the United States. Regular physical activity improves health in the following ways: reduces the risk of dying prematurely, reduces the risk of dying prematurely from heart disease, reduces the risk of developing diabetes, reduces the risk of developing high blood pressure, helps reduce blood pressure in people who already have high blood pressure, reduces the risk of developing colon cancer, reduces feelings of depression and anxiety, helps control weight, helps build and maintain healthy bones, muscles, and joints, helps older adults become stronger and better able to move about without falling, promotes physiological well-being. Health burdens that could be reduced through physical activity. Millions of Americans suffered from illnesses that can be prevented or improved through regular physical activity. 13.5 million people have coronary heart disease. 1.5 million people suffer from a heart attack in a given year. 8 million people have adult-onset diabetes. 95,000 people are newly diagnosed with colon cancer each year. 250,000 people suffer from hip fractures each year. 50 million people have high blood pressure. Over 60 million people, a third, of the population, are overweight. The challenge. Although there is clear scientific evidence that regular physical activity has powerful positive effects on both physiological and physical well-being, 33% of the United States senior citizens are classified as sedentary. The cost to our nation of this physical inactivity is exorbitant. It contributes to the escalating cost of healthcare expenditures for the elderly, which exceeded $9.76 billion in 1993. Worst of all, lack of physical activity most certainly results in needless infirmity and loss of independence for significant segments of our aging population. The Center for Disease Control believes that programs to facilitate increased physical activity among the aging population are crucial, both to the quality of life of senior citizens, and to the economic health of the nation.